Hi, okay, so we're continuing on what your physical illness says about your psyche. I want to clear up a few things from previous videos that I thought maybe I wasn't clear on, and then I want to go into some other things. So in your previous video, I talked about how I had this client who was concerned about having a child with some issues because her niece or her nephew had been autistic. And I explained that the parents' repressed issues will come out as illness in the children. So one of the things that we know, and it's stated over and over and over again, behavior change usually takes up to 2 years to occur, real behavior change. So oftentimes with public health or with dietetics or with a lot of different fields, we talk about getting clients sort of cleaning up their diet or cleaning up their lifestyle 2 years before having a baby. And one of the reasons is to address exactly this, so that the shadow, the repressed memories, the emotions can come out during that 2-year stint, and then the client can address it, whether with its mental health or physical health or emotional health, and that can help the baby. In Ayurveda, the oldest medical system, we talk about this, and we'll talk about that in the future, but Ayurveda speaks about prepping the body for 2 years so that the mind, the body, and the spirit can be sort of clean and healthier, so that the child's subconscious, remember, at conception, the state of mind that the parents are at is going to then make the child's physical, mental, and emotional body. So the more time we can prep, so to speak, go deeper into our repressed memories, our emotions, our issues, the healthier the child will come. But there is a likelihood that a child comes with an issue because there's a repressed issue that parents have. So I wanted to clarify that in case that wasn't clear. The other thing I mentioned that I wanted to clarify was this woman who was worried about her son who had the speech pathology issue. And one of the things that illness does, illness is one of the very few things that allows us to get attention that we would not normally have. When we go later on into chakras, into planets, into different energies and some of the astrology stuff, we're going to talk about the sign Virgo. Virgo is the sign of doctors, of health, of repressed guilt and ancestral memories. And oftentimes, Virgo children or people that have a lot of Virgo in their chart or hold on a lot of guilt will channel through illness, is the way that they will indicate that they need time with the parent, that they need to feel like a child because perhaps they grew up too quickly. So we'll tie all of this in throughout the health psychology module. But I wanted to mention those two things in case I wasn't clear. So children with illness can come to represent repressed issues and emotions of the parents. That way the child helps the parent solve those in the lifetime. And if your child does come with certain illnesses, even if it's not severe, in this case of my client with the speech pathology issue, it is oftentimes the child needing some individual attention, or it's the only way that the child can understand or ask symbolically for attention. And in this particular client's case, there were 3 children. They were all very similar age, and because that mother had cared for her sibling when he was dying as a little child, what was in the subconscious of the mother was, you only get attention if you're sick. Because she didn't get the attention, the sibling got the attention. And so she passed that on in the womb to the children, and this particular child took on to that and now was reflecting with this issue. So I just wanted to clarify those things before we move on to the next thing. So I want to talk a little bit about things that happen in the body and what they mean. and why we choose a particular illness. I mentioned yesterday that one of the things that we're doing when we pick an illness, if you will, is the body is trying to conserve itself. If you have an illness, let's say like cancer, and we'll start with cancer, and it spreads all over, which in some people's cases it does, then it will kill us. Remember that the number one thing is to maintain homeostasis and survival. So if I have a repressed memory, if I have a unresolved emotion, then I'm going to package that up and I'm going to send it to the organ that is related to the issue that I have not dealt with, okay? So I have repressed emotions here on the board. It's super important that we understand what we do not process gets packaged in our cells, whatever trauma we have, and is sent to the organs that are related to that. So, beautiful man, Dr. Hammer, who sort of started a lot of this research that has now become somewhat worldwide. We have biodecoding, we have a lot of these trauma theories, and they're related to this. But Dr. Hammer and his wife lost a child. I believe he was a German doctor. And they lost a child, and within months of losing their child, he developed, I believe it was prostate cancer, and his wife developed cervical or ovarian cancer. And so being a physician, he was like, there's got to be something here because neither of us have, history of this. And he started calculating that the trauma of losing their child must be directly related to the location of where they both got their cancers. So we'll talk about cancer and tumors in a second. And what he started discovering and then went on for many, many years to gather research, and from that research, all of these new sort of treatment models have been developed, is that when you suffer a trauma, for instance, losing a child would come from the reproductive area. Both mother and father developed a tumor in the reproductive area. Now, why a tumor? Why a cancer? When you have something that creates a growth, like cancer, it is something that we feel detached from. So growths cause something to grow so that we can have more of it. We want more of this particular organ. So for instance, I had breast cancer. Years before that, I had to give my ex-husband 50% of the time with my children. I wanted more baby. I wanted more mom. I wanted more nurturing. Therefore, I got a cancer on my left breast. So I felt detached from something, and I created a growth because I felt detached from something. Reverse is if something is deteriorating in your body. If something is deteriorating, for instance, bone, something like osteoporosis, then there is a lack of value or self-worth, and you were feeling that there was an aggressor. So for instance, with osteoporosis or some other debilitating or deteriorating illness, someone attacked you or there was an aggressor towards you, that what you want is to shrivel. You want to deteriorate so there's less of you. You want to minimize. What the aggressor can come and do to you. So these are some of the subconscious responses when we have illness. All illness, all physical illness is the last resort that the body had to get your attention. Usually, you're dealing with some sort of spiritual or psychological trauma. Perhaps something is taken from you. And we say that these things are opportunities for us to grow. So that's sort of like the universe knocking. You didn't get the message. I did not get the memo about the cancer. I'm stubborn. Then it affects your sort of emotional body, if you will. I didn't get the memo. That the last resort is the physical. So if you're dealing with physical issues, if you track it back, you're probably going to find out that you've been given warning or signs many, many, many months or years before, but you, probably like me, very stubborn, didn't do anything about it or didn't get the message until it became physical pain. Most of us, what we do with psychological and emotional pain is we suppress and repress. We put it away, we put it away, we put it away. Oftentimes with poor coping. So let's give a typical example. Drink to avoid the pain. All of a sudden, you get cirrhosis of the liver. Is it really cirrhosis of the liver, or is it attached to some poor coping mechanism when you lost your job many months before that you couldn't cope with, and now it turned into a physical ailment? So when a client has something physical, try to backtrack and see what psychological, what emotional things are repressed there so that you can get some answers to why the physical. And remember what I said yesterday. Ask what the purpose, the function of that organ is so that you're able to sort of identify perhaps what was taken or what the lesson is, if you will, behind the illness. All illness is linked to repressed emotions. Things that were not ever looked at clearly. Things that were never really taken out of the shadow or the darkness. This does not mean it was individual. We oftentimes are carrying ancestral, from many, many, many ancestries, many, many generations past. We're bringing these emotions passed on, passed on, passed on. One of the things I discovered in my own process of working through my breast cancer was my mother lost a child, my aunt lost a child, my grandmother lost a child. We did not have more information, but presumably there must have been more losses. So the way that I lost a child, I sort of, changed the story a bit, was by losing custody. So even though I had my children alive and well, I honored the ancestral story through that, which then led to the illness of breast cancer, to force me to look at what emotions were there. So sort of packaged up in the illness is an unprocessed or a repressed emotion, and that's what you want to get with to the client. Oftentimes, and I've talked to you about this before, you have the emotion wheel, and there are basic primary emotions, and from those emotions, other emotions come out. The other day, I saw something that I thought was just beautiful on social media. It said, I sat with my anger, and she told me her real name was grief. And I just thought that was so beautifully phrased. And that's oftentimes what is happening, is that we're displaying one emotion, but really it's hiding, shame or guilt or grief or sadness that we're not actually able to get access to. The other thing with guilt, I always say, is that guilt is a socially acceptable emotion to hide something that's less socially acceptable. So if we prod and poke and we talk more, we'll usually get to the real shame that's behind the emotion. The benefit, because there is a benefit to physical illness, is that the body is giving us the answer in the organ. So earlier this morning I was talking to a colleague of mine, and she was telling me about a friend of hers who had some liver illness. And the liver, and you know my drawing sucks and I don't know how to draw a liver, but is the largest organ besides the skin. So the liver has the ability to deal with abundance. It's one of the sort of subconscious messages. So usually when there is an abundance issue, a lack of, the liver is affected, or something was taken where the person felt lack, or they didn't feel an abundance. The kidneys are directly related to water and direction. Obviously, it's a filtering system, but water is related to life. Oftentimes, it could be related to the mother, since the mother and water are related, but it has to do with direction. Did I make a wrong choice? Did I go in the wrong direction? People oftentimes that are dealing with kidney issues feel like if their whole world has sort of shattered and they don't have like a solid footing. They don't know which direction to take. So again, get in the habit of asking, what is the function? You as a therapist, but also for your client. You might get different answers, but you'll start piecing it together. The other thing I want you to start thinking about is diseases that are not in the demographic of your client. If a client comes to you and it's very atypical that that client would get this illness, there is a reason, there is a message. Remember, the problem is the solution. So I had a client who got a diagnosis of a certain cancer in a part of the body that most people in her demographic do not get. And as we uncovered the story, it turns out that this type of cancer is what, males get, older males, and she was a young female. Different socioeconomic class and different ethnicity. It was completely improbable that this woman would get this disease. But as we questioned and as we sort of peeled back, we realized that this was what was hidden in the emotions. Her desire to be this older demographic, this different ethnicity. And so she created an illness that gave her the probability of becoming that person in the illness that she chose. And I understand that you have to wrap your head around that we create these illnesses. But if it's the body's last sort of line of defense for us to get our attention, we need to sort of have a knock that we're going to listen to. And oftentimes people can cope poorly with emotional and psychological pain, with drugs, with alcohol, with sex, with gambling, with a slew of things. But physical pain is a little different. They're allowed to go seek help. They're allowed to perhaps go to therapy and uncover the repressed emotion. And they're allowed, if nothing else, to just get some attention. And if we go back, we remember that in the subconscious, the child was born to meet the parent's needs, not the other way around. So therefore, illness is an opportunity for us as children, as adults, to finally get our needs met, or at least get some attention. Thank you.